It's important to be proactive in ensuring your future health, and that can be done through lifestyle measures and attending health checks. There are some health checks that are specific to women, and that can include things like your cervical screening and your breast screening programs. And I always recommend that women do attend these appointments when they're invited. But it's not always about waiting for those screening program invites to come through. If you do have any symptoms, it is important to speak to your healthcare professional about them. This can be of particular pertinence if you have a family history of certain women's types of cancers. So for example, breast cancers or ovarian cancers, as they can be significantly genetically linked. There are certain symptoms and signs that I always ask women to look out for and come see me about if they do develop them. It can be really hard to know what all those lumps and bumps in your breasts are, and that's why it's so important just to know what's normal for you. And so I would always recommend regularly checking your breasts, and if you notice anything different, it's time to see your doctor. More often than not, those lumps are just benign collections of connective tissue or cysts or fatty lumps, but your GP will be able to examine you and determine whether it's something that can be monitored or whether it's something that needs to be seen by the specialists. Abnormal bleeding. There are many reasons our periods can change, including stress, diet, exercise, weight changes, but if your periods are persistently irregular, more painful or more heavy, you should speak to your doctor. Furthermore, you should also seek help if you're noticing any bleeding in between your periods or bleeding after sex. You should also see your doctor if you are postmenopausal, so that means you no longer have periods, but you've started bleeding again. This always needs to be investigated. Bloating. Bloating can be a very benign sign of diet or gut issues, so not often anything to worry about, but it is a sign of ovarian cancer. So if you have had bloating for 3 weeks or more and it's not been investigated, you should speak to your doctor. Other signs of ovarian cancer can include feeling full, losing weight, loss of appetite, problems passing urine, and pelvic pain. Vaginal discharge. Vaginal discharge is normal. We need it in order to keep our vaginas moist and in order to protect us from infections, but sometimes it can be a sign of other things. If it's become more profuse, irritating, changing colour, bloody, smelly, you do need to speak to your doctor to investigate what the underlying cause could be. Another part of our women's health check can be a discussion around fertility. For those trying to conceive, it can be very frustrating when it takes longer than expected. But to reassure you, 84% of women will fall pregnant within 1 year of having regular sexual intercourse. There are certain lifestyle measures that you can try to improve your chances of falling pregnant if you have been trying to conceive with no luck. Stay within a healthy weight. We know that those that are overweight have a reduced chance of falling pregnant without assistance. So ensure that both you and your partner are within a healthy weight boundary, but also eating healthily, a well-balanced diet full of nutrients and vitamins. Take supplements. In pregnancy, it's advised that you take folic acid prior to conceiving and continue it for up to 12 weeks off conceiving. You should also be taking vitamin D supplements in order to ensure healthy bone development and a healthy immune system. If you're a vegan or vegetarian, you may worry that you're slightly low in iron or vitamin B12, so this is a discussion you can have with your doctor. Alcohol. We're all aware not to be drinking alcohol whilst pregnant, but it can also impede your chances of falling pregnant. Studies have shown that even just 3 glasses of wine a week, which is well within the recommended limits, can reduce your success of falling pregnant, and that's for both men and women. Smoking. Smoking can also reduce your fertility and the success of birth rates. We also found evidence to suggest that smokers reach the menopause 2 years earlier than non-smokers. So I would very much suggest quitting before you even get pregnant. exercise. It's important to stay physically active and healthy in order to try and conceive, but beware of over-exercising, as we do know that excessive exercise can impede our hormone levels, especially our estrogen, which can therefore affect our chances of falling pregnant.